Claire Burton ran her bike into a car on Michigan Avenue. Vital stable. Can't get any answers out of her, but she definitely looks pregnant.
Claire, I'm Dr. Manning. Do you remember me?
I used to eat a lot of carrots, but you know, they don't really help your eyes. I don't really need them anyway, because the carrots, they don't really do anything.
Yes, bipolar. I treated her a few months ago for morning sickness. All right, let's move her on my count. Ready? 1, 2, 3.
Anybody we should call?
As far as I know, the boyfriend's out of the picture.
Sometimes if I look at something for too long, I feel like all that energy is going to turn into a laser and just burn a hole right through whatever it is that I'm looking at. I heal a lot faster than others.
Claire?
Like suddenly...
Does it hurt anywhere?
2 Haldol, please.
A lot of times I try not to look at anything
Claire.
but myself.
Claire, can you tell me if anything hurts?
Every single molecule of my skin.
She'll calm down in a couple minutes. I'm
activated.
right outside.
Okay, thank you.
And I just heal. Does anybody know what happened to my bike? It's just a cut. Maybe I could just get my bike and go.
What was her normal dose of quetiapine?
It was 800 milligrams, but I cut it in half to be safe for the baby.
Huh. That might explain the onset of the mania.
Well, the standard of care is to cut the dose in half.
And there's actually been some new research, a couple of new papers, both suggesting that
Dr.
work
Charles,
gradually.
I can't keep up with every psychiatric journal.
Of course you can't.
Or I didn't have a choice. I did what I had to do.
Dr. Manning.
What's wrong?
Your placenta must have abrupted from the accident. Call OB, we need to get her upstairs for a delivery.
Delivery? Did something happen to my baby? Is he going to be okay? What's wrong with my baby?
Everything's gonna be fine. Let's get you upstairs, and then we'll figure out what happens next, okay?
Are you sure I didn't hurt the baby? Are you sure? What if I hurt it? What happened? Why did we stop? What's going on?
I don't know.
Why are we here? What is this place?
Orthopedics. They're renovating the rehab floor.
I'm supposed to have my baby. You said I was bleeding.
Emergency exits are locked.
I was thinking maybe a code orange would explain why the elevators went down.
Oh, there's a lot more blood. A lot more blood.
Her bleeding is much worse. Call labor and delivery.
Worse? What does that mean? Is my baby dying?
No, we need to lay you down, okay? Come on.
He's dying, isn't he? My baby's dying.
No, he's not. Come on, let's lay you down. Just lay down right here. You're all right. There you go. Dr. Charles?
There's no signal. I can't find a signal.
Oh my God, I killed him.
Just stay right there, okay? We have to figure out a way to break open these doors. We need to get her upstairs.
Natalie, we're not getting through those doors. We're gonna have to do a C-section.
It's all my fault. I killed my baby.
I've never done a C-section. I haven't even seen one in years.
We're gonna figure it out.
But we don't have any instruments or emergency supplies or pain meds.
There's gotta still be some supplies on this floor.
What if we just held pressure? I mean, whatever's happening in the hospital right now can't last forever.
We have to do this now. We don't have a choice. Listen, whatever doubts you may or may not have about your previous treatment of this patient,
I led her to believe that she could go through with this pregnancy. She can't take care of a baby. She can't even take care of herself.
and you were in a very difficult situation.
If I operate on her in this hallway and she dies, that's my fault.
Okay. Okay, look, I'm going to find a signal and get an OBGYN on the phone.
But no one can get down here.
No. So she can talk us through it on the phone. Together. Okay?
Do you have reception?
We got 1 bar, it's ringing.
I'm not cutting until you get someone.
Cutting melon, cutting chicken, cutting meat, cut the baby.
No one's gonna hurt the baby,
chicken's
Claire.
not gonna cut the
Her
baby
Haldol's
chicken.
wearing off. Is someone answering?
It's cutting me, it's cutting me.
Yes, this is Dr. Charles. I need an OB immediately to talk me through an emergency C-section. They're getting Dr. Grant.
Come here and put her on speaker.
I can't. I'll lose the call. I'll drop the call. Dr. Grant, thank God. I have a woman, 36 weeks, abrupted placenta, already lost a couple units of blood. Some lidocaine, which we've administered, a scalpel, and a few clamps. Okay? Okay, here we go. Dr. Grant says to start the incision 3 centimeters below the umbilicus.
Okay. Here we go.
She's through the uterine wall.
Hold on. The placenta's in the way. I can't see the head. Ask Dr. Grant if I should extend the incision or reach through the placenta.
Can you reach around it? Is there any room?
Ask Dr. Grant.
Yes, Dr. Grant. Dr. Manning wants to know if she should extend the incision or go through the placenta. Dr. Grant says that she totally trusts you to make that call.
No, she needs to tell me which way to go.
Make the call, Manning. Manning makes the call.
Dr. Grant says that without being there to assess the position of the placenta, there's no way that she can make that determination. You need to decide.
I'm going through the placenta. It's too high. I need you to come over here and push down on it.
Okay. Here?
Yeah, I think so.
Okay. I'm sorry, but you're gonna feel this.
God, get out of here!
You got the baby?
No. Maybe I should do the incision.
Get off me!
Push. Got it. Got him. Keep pushing. I got it. He's not breathing. His trachea is blocked with secretions.
What do you need?
An aspirator, something to get the secretions
All
out.
I got is IV tubing.
Give it to me. He's okay.
You did it.
Yeah. Dr. Grant, how's Claire doing?
She and the baby are both stable. You did a nice job.
Well, I couldn't have done it without you.
I don't follow.
The phone call with Dr. Charles. Thank you for getting me through the C-section.
I wasn't on any phone call.
Dr. Charles, you lied to me.
Yes, I did.
You tricked me into doing a surgery that endangered both Claire and her baby. What you did was reckless and unprofessional. You had no right to manipulate me.
Can I show you something?
She looks good.
Yeah. Meds kicked in. Listen, you were trying to solve a very tricky problem, and most doctors would have tried to talk her out of this pregnancy. But you saw the woman, not the mental illness. You have excellent instincts, Nat. Just gotta trust them.